Here is detailed, structured, and clinically thorough information about Linezolid, ideal for medical, nursing, or pharmacology study purposes. 1. Generic name, drug class, drug forms, brand name. Generic name, drug class, oxazolidinone class of antibiotics. Drug forms, oral tablets, 600 milligrams, or 100 milligrams, oral suspension, 100 milligram of either, reconstituted. Intravenous injection, 2 milligrams per milliliter in 300 milliliter solution, ready-to-use IV bags. Brand name, Zyvox, Pfizer. 2. Definition. Linezolid is a synthetic antimicrobial agent classified under oxazolidinones. It is used primarily for the treatment of serious gram-positive bacterial infections, including those resistant to other antibiotics like MRSA, methicillin-resistant Staphylococcus aureus, and VRE, vancomycin-resistant Enterococcus. It can be used both orally and intravenously, making it versatile in inpatient and outpatient care. Hammer 3. Mechanism of action. Linezolid exerts its antibacterial action by binding to the 23S ribosomal RNA of the 50S subunit of the bacterial ribosome. This inhibits the formation of the 70S initiation complex, a critical step in bacterial protein synthesis. Unlike other protein synthesis inhibitors that act during elongation, Linezolid uniquely inhibits the initiation phase. It is bacteriostatic against enterococci and staphylococci, but bactericidal against most strains of streptococci. 4. Indications. FDA-approved uses. Nosocomial, hospital-acquired pneumonia caused by MRSA or Streptococcus pneumoniae. Community-acquired pneumonia, complicated skin and skin structure infections, including those caused by MRSA. Uncomplicated skin and soft tissue infections. Vancomycin-resistant Enterococcus faecium infections, including bacteremia. Off-label uses. MDR, multidrug-resistant tuberculosis, nocardiosis, resistant infections in immunocompromised patients, e.g. transplant recipients. Contraindications. Known hypersensitivity to Linezolid or components of the formulation. Concurrent or recent within 2 weeks, use of MAO inhibitors due to the risk of serotonin syndrome or hypertensive crisis. Uncontrolled hypertitoma, carcinoid syndrome due to monoamine oxidase inhibition. 6. Before taking this medicine, precautions. Before starting Linezolid, inform your healthcare provider if you have hypertension, thyroid disorders, bone marrow suppression, history of anemia, thrombocytopenia or leukopenia, liver dysfunction, kidney dysfunction, especially if on dialysis, history of seizures or epilepsy, diabetes, especially if on insulin or hypoglycemic agents, risk of hypoglycemia. Dietary precautions. Avoid tyramine-rich foods, e.g. aged cheese, soy sauce, wine, fermented products, which may precipitate hypertensive crisis due to MAOI activity. Pregnancy and lactation. Use only if clearly needed. Limited human data. Animal studies have shown potential risk. Avoid breastfeeding during treatment due to the possibility of excretion into breast milk. 7. How to use. Oral tablets. Take every 12 hours. Can be taken with or without food. Swallow whole. Do not crush or chew. Oral suspension. Shake well before each dose. Measure with a calibrated oral syringe or dosing cup. IV infusion. Administered over 30 to 120 minutes via central or peripheral line. Usually administered in a hospital or infusion center. 8. Dosing information. At adults, 18 years, standard dose, 600 milligrams every 12 hours. Duration varies by infection type, usually 10 to 14 days, can extend up to 28 days with caution. Pediatric patients, 10 milligrams per kilogram every 8 hours, IV or oral suspension. Children, 12 years and older, 600 milligrams every 12 hours, same as adult dose. Renal impairment, no dose adjustment needed, but monitor for hematologic side effects. Hepatic impairment, no specific dose adjustment, but caution is advised. 9. Missed dose overdose. Missed dose? Take as soon as you remember. If it's almost time for the next dose, skip the missed dose. Do not double the dose. Overdose symptoms: nausea, vomiting, dizziness, lactic acidosis, hyperventilation, confusion, seizures, rare. Treatment: supportive care. Dialysis may help to remove some drug and metabolites. 10. Stop or avoid taking if Severe allergic reaction occurs, rash, swelling, difficulty breathing. Signs of serotonin syndrome develop agitation, hallucinations, sweating, tremors, rapid heart rate. New or worsening vision problems suggests optic neuropathy. Peripheral neuropathy develops. Tingling, burning in hands, feet. Myelosuppression occurs, thrombocytopenia, anemia, leukopenia. Side effects in detail. Common side effects: diarrhea, nausea, vomiting, constipation, insomnia. Serious side effects: 1. Myelosuppression includes anemia, thrombocytopenia, and leukopenia. Monitor CBC weekly, especially if used 2 weeks. Peripheral neuropathy, usually after prolonged use, 28 days, may be irreversible. 3. Optic neuropathy, blurred vision, color vision changes, vision loss. 4. Lactic acidosis, due to mitochondrial protein synthesis inhibition, manifests as deep breathing, muscle pain, weakness. 5. Serotonin syndrome, particularly if taken with SSRIs, MAOIs, or serotonergic agents. Symptoms: agitation, hallucinations, fever, tremor, hyperreflexia. 6. Seizures, rare. 12. Vital information. Monitor CBC weekly if treatment exceeds 2 weeks. Avoid with SSRIs, MAOIs, TCAs unless under careful supervision. Tyramine-restricted diet is essential to avoid hypertensive crises. Watch for neurologic and visual symptoms, especially with prolonged use. Effective only against gram-positive organisms, ineffective against gram-negative bacteria. No cross-resistance with other antibiotic classes. NASHA 13. Other drugs that will affect linezolid: major drug interactions, serotonergic agents, SSRIs, SNRIs, TCAs, MAOIs, tramadol, fentanyl, methadone, risk of serotonin syndrome. Avoid unless no alternatives and with careful monitoring. Adrenergic agents, pseudoephedrine, dopamine, epinephrine, risk of hypertensive episodes due to MAO inhibition. Buspirone, increased serotonin syndrome risk. Insulin or oral hypoglycemics may increase hypoglycemia risk. Antiplatelet agents, aspirin, clopidogrel, may increase risk of bleeding with thrombocytopenia. Summary notes for practice: parameter linezolid may increase IV, drug class, oxazolidinone antibiotic, use gram-positive infections, MRSA, VRE, pneumonia, skin inf, root oral, IV. Mechanism: inhibits 70S initiation complex, protein synthesis. Monitoring: CBC, vision, lactic acid if symptoms suggest. Avoid SSRIs, MAOIs, tyramine-rich foods. Risk: myelosuppression, neuropathy, serotonin syndrome. Thank you. Have a nice day.